Hi, everyone. Welcome to episode 13 of Let's Talk Mental Health. As promised again, today we have a very important and special guest. Our guest is a social worker, a mental health practitioner. She's been practicing the mental health field for the past 4 years now, and she's a clinical social work student. She's a Christian and she's married. She'll be teaching us today about oppositional defiant disorder, commonly known as ODD. Let us welcome Mrs. Jaso Arvina Maholo Bobo.
Hello everyone, I'm Jaso Maholo Bobo. I am a social worker and a mental health practitioner. So I will be discussing ODD, which is oppositional defiant disorders, some of the common signs and symptoms, the causes, and how it can be managed. Oppositional defiant disorder is a behavioral disorder that is typically diagnosed in children and adolescents. It is characterized by a pattern of defiant, disobedient, and hostile behavior towards authority figure. This behavior goes beyond just the common childhood defiance and can affect the child-family relationship and social interactions. Some common signs and symptoms of ODD includes frequent temper tantrum. You'll see that the child will get angry easily. Arguing with authority figures, always want to argue with people who are older than them. Refusing to comply with rules and regulations, deliberately annoying others or provoking others to anger. There are two major factors that contribute to the development of oppositional defiant disorder. We have the biological and genetic factor, and we have the environmental and parenting factor. For the biological factor, children who have family history of mood disorder like ADHD, which is the attention deficit and hyperactive disorder, and the oppositional defiant disorder are more likely to have this ODD. For the environmental and parenting factors, sometimes harsh, inconsistent, or neglectful parenting, especially involving lack of positive reinforcement and always frequent punishment, can contribute to this disorder. If the child does something right, sometimes it's better to reward them instead of always waiting for the wrong thing to punish them. Now, how can this disorder be managed? It can be managed through therapy or medication if needed. Sometimes the cognitive behavioral therapy or the family therapy. Thanks for listening again. I'm Jaso Maholo Bobo.
And that's about it for today's episode. Thank you so much to our teacher Jaso for teaching us today about oppositional defiant disorder. I am Merva M. Smallwood, a clinical social worker. And remember, an informed mind leads to a changed behavior. Until our next episode, adios.